Well, my name is Ralph Moss. I live in central Pennsylvania, and I have a company called Cancer Communications Incorporated, which is both a publishing company and also an internet-based information company. So we are purveyors of independent information, or we're independent purveyors of information on the cancer field. We're not tied to any clinic or any particular school or school of thought. We basically try to, with the help of our scientific and medical advisors, to reach some objective information, objective position on the value of different treatments. And we're interested in both looking at the conventional treatments, the school medicine treatments, as well as the complementary or integrative or alternative treatments. And we pretty much have a single yardstick for both treatments. We try to find the best evidence-based practices. That said, I think there's an inherent superiority to the complementary and alternative or CAM treatments in that most of them are less toxic than the conventional treatments. So yes, I do have a certain prejudice towards the CAM approach because I think it's more user-friendly, more patient-friendly, more sparing of the immune system. But that doesn't mean that it automatically gets a free pass. Everything has to be evaluated, and that's my philosophy. And I think the evaluation has to be more than just one physician's opinion about the results of his own practice. I mean, there's a value to those subjective impressions, but more valuable is systematic tabulation of data of what happens in the clinic when you apply certain treatments, which could result in either a best case series or else in a retrospective review of the outcome of treatment for different kinds of cancer in the different clinics.
What will be your speech about?
Well, it's really two related topics. The first part of my speech is about the failure of the war on cancer. And the second part of the speech is about my journeys to go around the world and look at different clinics that are doing things other than the straight typical academic type of approach. So these are related, at least in my mind they're related. But the first thing, since this is the 40th anniversary of the war on cancer, I think it's very important to come to a realistic assessment of the war on cancer. And that's the first part of the speech.
And why do you think all these billions and trillions of money and research were not so successful?
Well, it certainly hasn't been for lack of money. $100 billion should go a long way in terms of doing medical research. And this was maybe 5 years ago, there was an estimation that that's how much had been spent. It may be closer to 150 billion, but I don't think, once you pass 100 billion, who's counting, And the other thing is, it's not because of lack of talent, because certainly some of the brightest people you're ever likely to meet are involved in the cancer field. Many Nobel laureates, many really genius level people. So I have to think that it's the paradigm within which you work that limits your ability to make discoveries. In other words, if we look at lung cancer, which is a particular interest of mine, you find that over the past 40 years, there really has been virtually no progress made in survival, increasing survival in people with inoperable lung cancer. Yes, there have been, of course, improvements in the general area of surgery. There's much more known about chemotherapy. There are many more targeted drugs. The radiation equipment is light years ahead of where it was. And yet, remarkably, there's only a few percentage points difference between the survival, the 5-year survival rate as it stood in the 1970s, and the 5-year survival rate in the 21st century. I find this to be an astonishing figure, yet it's hiding in plain sight for everybody to see. If you go into the SEER database, which is the U.S. government's database on outcomes in cancers of various kinds, and you can break this down by sex, by race, by state, by region, whatever, however you want to age, however you want to look at it. And yet across the board, there's just been really very little progress. And I think lung is not the exception to the rule. I think that it is fairly typical of what you'd find if you looked at liver, if you looked at stomach, if you looked at brain, if you looked at many other organ sites for the advanced stages of the disease. So I think what we're looking at can only be characterized as a general failure of the war on cancer. Now, I know this upsets a lot of people to say this. It upsets the scientists who have devoted their lives to advancing the war on cancer, and it upsets some patients. And of course, some people will probably contact me and say, but I was cured and I was saved. Well, that's probably true. I mean, although sometimes people do misinterpret their own condition. But, you know, there are some people being saved, being cured, no question. But the general, if we look at the general picture of it, what has happened in society over 40 years, it's astonishingly unimpressive, astonishingly ineffective for the advanced cases. Now, in the operable cases, because surgery has improved, because radiation has improved and so forth, people do live, you know, have a good chance of survival. And I think their chances have improved somewhat in that regard. But what I'm thinking of mostly, I think what we're mainly looking at is the impact of chemotherapy. It's been very, very small for many cancers. But we have to give, you know, be fair and give credit where it's due. And so I don't want to draw an entirely negative picture, because there have been improvements. There are brighter areas, and I disagree with a lot of my friends and colleagues who say never use chemotherapy. It's worthless. It's more harm, does more harm than good, and so forth. I don't believe that. I believe, for instance, in women with advanced breast cancer, or let me not say not advanced, but that's not what I want to say. What I mean is dangerous cases of breast cancer, triple negative or hormone insensitive tumors, larger tumors, tumors that have a higher grade and a higher stage. Chemotherapy can sort of, given after surgery, can level the playing field, make their results more similar to those who have hormone receptive tumors. I've had arguments with good friends over this who feel that, you know, the numbers are not impressive, especially for older women, that maybe it's justified for the younger women. But we could debate this, but I think that we have to acknowledge when conventional medicine scores a success, it's important to acknowledge that success, because otherwise I feel that the field of complementary medicine loses credibility when it tries to be, you know, be all and end all for every person. And there are economic factors on the side of the alternative doctors that, of course, they would like to get those patients themselves for treatment, and I'm sure they believe they could do a better job. But I think we need to be fair in our evaluation of both the conventional and the complementary. And you have to worry also that when things become dichotomized, when they split into two antagonistic groups, like two teams in sports, there is a tendency to knock everything that one side's doing and promote your own side. And I think that this is very dangerous. We shouldn't feed that tendency, even though we know that the conventional medicine is often extremely unfair in the way that they criticize the complementary medicine and sometimes even lie about it. But that's not a reason for the complementary people to lie about or discredit or diminish the achievements of the conventional medicine. Where do you get objective information? Because, I mean, behind that question, aside from me giving you my personal opinion, you have to have guidance as a patient. You know nothing. You could probably come into this cancer field with, never having thought seriously about cancer, and then suddenly you're a patient or someone you love is a patient, and you've got a very steep learning curve, so you need guidance. And so, I think you have to look for those sources of information that seem to be objective. That's the most important thing, because everybody, seems to have an axe to grind. Everybody's selling a therapy, and there's a lot of self-interested statements on the internet in particular. And you have to keep your head and not be overwhelmed by false promises that are going to lose time and probably cost you a lot of money. The two things you don't want to lose in this situation are time and resources, because you're going to need those things in order to get proper treatment. I think organizations like this one, the GFBK, are invaluable. They're invaluable for a couple of reasons. One is because they are independent, and from that independence flows an ability to objectively, fairly evaluate the different options that one has. I hope that our organization in the United States, our Cancer Decisions website, we try to be objective in a similar way, which is why I'm here, which is why I've always had a great relationship with this organization. And going back to at least the time I spoke in the year 2000 at the biannual meeting in Celle. So I think that you have to look for objective sources, and there are objective sources within the establishment, within the official pages, and also within some of the alternative sources as well. But you have to find them for yourself. They're out there, but you have to be very careful if you find people making exaggerated claims that you don't go for those things.
What I wanted to hear, because you spoke yesterday about therapy.
Well, yeah, so my evaluation of the field, and I don't think this is at all controversial, is that of all the treatments that are given in the complementary clinics, hyperthermia or thermotherapy is the most documented. And I would say that we are now on the verge of its acceptance within academic medicine. We've had the clinical trial done in Munich, centered in Munich with Dr. Ralph Issels on soft tissue sarcomas, which had, by and large, had positive results. And we had the Van der Zee clinical trial in Holland on stage 2 and 3 cervical cancer, both cases where hyperthermia was given in conjunction with the conventional therapy. That's how it was evaluated, and it's probably how it's best used. So we've had these two instances in the last couple of years in which there were positive results of clinical, really rigorous, multi-center clinical trials. That's about what you need to prove the case in modern medicine. A couple of well-conducted, large, multi-center, randomized clinical trials. That should set the stage for the wide acceptance of the treatment. Now, of course, you need to see what it does in other kinds of cancer. But we do have a fair number of clinical trials that have been done. These were summarized a few years ago in one of the major radiation textbooks by Ellen Jones at Duke University, which is our preeminent center for hyperthermia studies in the U.S. And if you look in that textbook, you can see that there were already 6 or 7 clinical trials of a lesser rigor, lesser quality that already